All right, picking up with some scapular stabilization exercises. First thing on the list is scapular PNF, rhythmic stabilization, alternating isometrics. We've kind of already talked about that, so we're going to skip through that. We've got our wand hold, alternating isometrics. So essentially, you're just using the wand, either pulling or pushing on it and then having the patient just try and hold their position when you do that. So you can do all the different planes kind of with that one. We've got the body blade here. The trick to this, you gotta have to get a feel for it and get the right oscillations going. You want to try and not be moving the whole arm, but you want it to just be kind of flapping a little bit with a minimal amount of arm movement. And it can be tricky to get the rhythm. So different positions, it's easier to kind of get the timing of it, but other times it's kind of hard. So you can do it in abduction and adduction, coming up and down. Again, you kind of got to play around with it a little bit. You can do it more with that elbow close to your side and try and keep it wiggling while you're internally and externally rotating. You can do it kind of on diagonals if you want to do it as well that way. So again, it does take a little practice to get the timing down, and you'll constantly have to correct patients when they're doing it and get them back in sync. But a very good stabilizing exercise. Makes it kind of have to work mostly isometrically, but kind of having to fire both eccentrically and concentrically as it resists the different direction as those little wings are flapping back and forth on that. We've got our rows. So rowing you can do a lot of different ways. I'm going to work a lot on things like posterior delt, rhomboids, traps, middle traps in particular. Traditional bent over row, you can do it with either a barbell or a dumbbell. I'm going to pick a heavy one. If you're going to do it in standing, then you want to kind of follow the same kind of things that we talked about with the squat. Maintain that lumbar lordosis. You want to stick that butt out, kind of bend at the waist, and in the sense you get your hands equal distance apart and pulling up just like this. You can do it with individual dumbbells or with a barbell like this as well. I kind of like doing a one-arm row using the bench. And so I'll just take a dumbbell, put a knee down, raise my hand on the bench, and then just pulling up this way. Well, especially if you've got a patient that's just trying to work on one arm, then you might not want to use a barbell type setup. You could just use a dumbbell that way. Doing it that way, you don't have to worry about the back, but if your goal is also to try and get some core strengthening, then doing it unsupported with the barbell or dumbbell and standing is going to do that a little bit more. We've got the total gym, which is a great way to work on rowing exercises too. I would usually kneel on the sled, kind of sit back, and then you can pull here to do your row. The nice thing about the total gym, you can vary that hand position really easily. You can do it at lower positions or potentially higher positions. So you can get kind of some of those same things like the I's and the T's and the Y positions with this as well. So I like that for the rows. Let me check my script. All right, we've got weight-bearing scapular stabilization. So essentially just leaning on the wall, leaning on a table in quadruped. If I'm just holding my position like this, I'm getting some scapular stabilization. It's really good if you're trying to work on this shoulder, then you can have the patient do different type of reaching activities and things like that where they're picking things up with their opposite arm, and that makes them have to really weight bear through that shoulder, engage those stabilizing muscles, and you can vary the angle. So if this is a more difficult position, you could do those kind of things also with the person supporting themselves against in a more horizontal type of position, kind of in through here, back their feet out if you want to make it a little bit more challenging. Again, just think about how gravity is working on their body and how much you want to challenge them. The more upright they are, the less weight bearing they're going to have through the upper extremities when those hands are in contact with the surface. The more horizontal they are, then you're going to have more. If you want to make it more challenging, then you can have them actually kind of be sloped downhill a little bit, so that we load things a little bit more. So if I put my feet up on something and then load, then you can get a little bit more force going through the joint than just being kind of in this more supported position here. You can do it on unstable surfaces, so you can do that on like on a Bosu or something like that, or even just on soft pillows, dense foam, stuff like that. And again, just trying to hold that position. Have them potentially move the other extremity to challenge the arm that is having to do all the stabilizing. If we want to we can do some weight shifting. So weight shifting, kind of same idea as the weight bearing activities. Whoa, that was close. You're just having them lean onto a surface, so I can start on a wall and then just shift my weight from one leg to the other. And that's just going to force me to kind of engage different parts of those scapular stabilizing muscles depending on which side I'm leaning to or from. You can do it on the plinth, you can do it on a bench, in quadruped, kind of all those different things as well. We've got stepping listed there, and we forgot to bring in the bench.
We're back.
All right, so stepping, essentially you're asking the patient to kind of shift their weight onto one extremity, step their hand up to a higher surface, and then essentially push up, bring the other hand up, and then you can have them step down. You can just basically doing step-ups like you would with your legs, but just doing it with your hands. You can vary that around however you want to do it. You can do things like push-ups on a ball. So have your hands this way, kind of dipping down and pushing in.
Show off.
If you want to make it a little more challenging, then you can get two balls, both hands.
Now he's really just showing off.
If you want it even more challenging, you can do a push-up and make it a little plyo.
I didn't think you could show off anymore.
Now I'm showing off. We've got ball walking. So ball walking, you're essentially going to have the person lay on the stability ball, kind of walk out, try and keep their core, their trunk rigid, and back them up. This ball needs more air. So that's the idea on ball walking. We've got all those same things on unstable surfaces as well. So those are all good options. We've got a lot of things we can do on the TRX system to work scapular muscles. We can get here, do our kind of protraction, retraction type of motion, pushing out. We can do more of a full push-up kind of position, coming down. We can do more flies. Again, these are kind of more glenohumeral than potentially scapular stabilizers. You can have the person invert and do your row kind of this way. If you want to just isolate the retractors, have them keep the elbows straight and just pinch those shoulder blades together. So lots of options with TRX. Let's see. We got tons of dumbbell exercises, shrugs with dumbbells. So that's easy. I don't know. Don't ask me. So there's your shrugs. You can go straight up. You can do more like a shoulder roll. So forward rolls, backward rolls, or just straight up and down with that. What else? We've got our some stuff that Johnny already did, the prone Ys, TheraBand. With Scaption, we've got wall jacks. So a wall jack is like a jumping jack, except you're doing it against the wall, trying to find a good wall. Maybe right here. And so the patient's just really trying to keep all of their arms against the wall as they come up and down. And you can have them actually trying to engage and push backwards a little bit to get a little bit more of an isometric effect with some of the retractors as you're doing that, but that's kind of the idea on the wall jack. We've got, I did the TRX, suspended, scapular retraction, prone T, so that's just lying on your stomach, bringing the arms out. We've got the corner press out. So the corner press out, scapular retraction, You're gonna put the elbows, humerus against the wall, kind of fall back into the corner, and then lift out. Probably have them walk their feet out a little bit to make it more challenging. So coming out to there, and then dipping back in. So that's your corner press out for the retractors. Don't trip. Scapular protraction, supine with the dumbbell. Just like it sounds, laying on your back, have the weight up, push up, lower it back down. So that's that one. We've got protraction, sitting or standing with TheraBand. We've got the total gym, protraction and retraction. And if you're doing protraction on the total gym, I don't know if this is long enough.
You may need to unattach it. Yeah, probably.
I don't think it's gonna, I guess I could do one arm at a time. Maybe not.
There we go.
All right, I had to think about this one for a little bit.
Got him in a safe position.
Protraction. Have your patient sit on the sled and basically have the elbows straight and just punching out and coming back in when they do that. It's not long enough to really do two arms. I guess you can. It's pretty tight though.
Yeah.
To do it with two arms. So I had the one arm down by my side to give me a little bit more slack on the other side coming up. Scapular retraction on the total gym is a lot easier. You can have the person in tall or short kneeling, keep the elbows straight and just pinching those scapula together when we do it. Just kind of like the row, but not using the shoulder and elbow motions. I lost my sheet. We have a lot of hazards in this room now. All right, push-up plus. You can do it on the wall for starters. I'll just kind of demo it right here for the wall. Essentially, right there, you can have the person come in and do your push-up and break that glass. And then at the end of the normal push-up, you're just getting that protraction motion going. On the ground, looks a little more natural than trying to do it on that rack of bars. But essentially come down in your push up, and then push up a little more with just the scapular motion. Scapular depression. We've got manual, so that's giving manual resistance. We've got your chair push up, essentially like that, pushing up. Total gym, not sure about that one, I have to think about it. TRX, suspended scapular depression, not sure about that one either. I got to think about that one a little bit more. Cut. All right, scapular depression on the total gym, like that. You can make it a little plyo, get a little bounce to it. Whee! Tired. That might hurt. Don't make it plyo. Don't make it plyo. Just keep it controlled. All right, I'm going to show you a few other total gym ones while I'm on it. We've got scapular shoulder extension, glenohumeral extension. So basically kneeling, tall kneeling, half kneeling, and pulling up that way. If you want to have less core, then go into a more supported position like this. We've got turn them sideways. You want to have a pretty small slope on this. You can do external rotation. I think it works better after if we do the second pulley. External rotation, kind of this type of position, and then rotating out. You don't want much of a slope on the total gym when you're doing this. Internal rotation, kind of here and coming in that way. But have the patient turn sideways on it. Always be careful helping patients on and off the total gym because it can be a little sketchy. All right, we've got a couple on the TRX that we didn't get. We've got our depression on the TRX, kind of walk their feet out a little bit. Let them go into elevation and then trying to press. It's a little hard. I probably wouldn't choose to do it with that.
Yeah.
But it is an option. If you're limited, you don't have maybe a total gym or some other equipment. Most of the rest of the things on here for the dynamic glenohumeral muscle strengthening should be pretty easy to think through. We've got extension using a dumbbell, using TheraBand. You can do it in prone or in, prone is going to be your best one for extension. External rotation, sideline is going to usually be the best position to target that. Internal rotation, kind of opposite sideline. Horizontal adduction, basically anything that's going to be like a fly or a bench press is going to be a good option with that. You can do it incline or flat. You can do it decline. Going to get a lot of pecs. Anterior delt going to be your primary ones. Kind of going through those. So I think if you've spent much time in the gym, you can figure out what a lot of these are. Horizontal adduction with the TRX, I'll show you that one since that's a little bit different. You're basically having the person kind of lean in, and you can either try and have them do it with their arms fairly straight at the elbow. That's going to be a lot more challenging to control, or let the elbows bend and then squeeze together, coming that way. So that's kind of your option on that. We've got biceps and triceps with the TRX. Again, hopefully you can figure that out with dumbbells. Biceps, you're going to usually go kind of something like this. Kind of walk the feet out, curl yourself up, straighten out. You can vary that hand placement depending on which elbow flexors you're trying to target. If you're trying to do triceps, you're going to come here like that, then push out that way. And again, varying your foot placement will make it harder the more horizontal you get, easier the more vertical you get with those. What else? Elbow flexion. Hopefully you can figure that out with TheraBand or a dumbbell. Different forearm positions. Extension, I think kind of same thing. Shouldn't be too hard to figure out how to help somebody extend their elbow and what your options would be. Again, always think about gravity. Think about whether you're using a weight, whether you're using TheraBand. Does gravity matter? Does gravity not matter? With those type of things. Are you focusing on eccentric, concentric, and try and figure out what's going to work the best for you and for that patient. Pronation supination with the forearm. Asymmetrical dumbbell, much like the hammer. This is probably too heavy to do, but I'm going to try it anyways. You're just doing it this way. So you'll hold on to one end of the dumbbell and let it rotate back and forth. So that's our dumbbell, asymmetrical dumbbell. You can use TheraBand and wrap it around the person's forearm, or wrap it kind of through their grip and have them have some resistance with TheraBand. Or you can have them just do a simple doorknob turn. I've seen people wrap TheraBand around a doorknob to create some resistance, so that's another option there too. Wrist flexion extension with the dumbbell, typically just going to do something kind of like this when you do it. And you want the forearm supported so that just the hand and the wrist are free, so that we can kind of isolate the movement at that joint that we're kind of after. And then we got dips. Great tricep exercise. You can do dips on a lot of different things. This is the best place in this room to do dips. Just lifting the person's body weight up, let themselves come down, and then pushing back up. Can do it in a walker. I do it in a walker. I wouldn't necessarily recommend it for a patient to do it in a walker.
Yeah.
So I think that's probably good.